12 weird signs that you have liver damage. In this video, we're going to be taking a deep dive into 12 weird signs and symptoms of liver damage. These are very important signs to be aware of because you can stop this disease from progressing and getting worse as your liver is able to completely regenerate with a little help. Liver disease is a condition that is affecting over 25% of people worldwide, and this number is growing at a rapid rate. Most people believe that liver damage comes from only drinking too much alcohol, but the truth is it can also be caused by eating too many sweetened, sugary, or processed foods and drinks, by consuming too many omega-6 vegetable oils and fast foods, using painkillers too often like acetaminophen or ibuprofen. Viruses can cause damage and hepatitis in the liver. Having too much elemental iron in the body can be a problem, and also toxins from the environments like pesticides, plastics, petroleum, and the list goes on and on. So, if you'd like to find out if there are problems with your liver, watch this video through until the end, as we will also be exploring some natural home treatments to clean the liver and prevent the damage from getting worse. Disclaimer: this video is for educational purposes only, so do speak to your doctor if you have any medical conditions. The first symptom of liver problems is pale stools when you use the toilet. Your liver releases conjugated bile acids to help digest fats from your food, which give your stool its normal brown color. If you have fatty liver disease or liver damage, however, this bile stops flowing properly through the bile ducts, causing your stool to become lighter, paler, or clay-colored, and it may float on the top of the toilet water because of the undigested fat that's making it buoyant. Symptom number 2 is poor night vision. If you notice that it's much more difficult to focus or see at night time, especially where there's poor lighting, this may indicate a retinol or a vitamin A deficiency. The bile that comes from your liver helps you to absorb vitamin A to help the rod cells in your eyes adapt to different levels of light. Having liver disease, however, causes a lack of bile so that you don't absorb enough vitamin A, triggering what we call night blindness. This can also indicate that you have a congested gallbladder, especially if your eyes also feel very dried out, sore, irritated, and gritty. Sign number 3 is a swollen right foot. When the blood isn't flowing normally through your liver, it can become swollen and enlarged, which puts pressure on the portal vein. This causes fluid or water to accumulate in the legs or feet, and then when you press your finger into the swollen area, it may leave an indentation. If you notice that the right foot and your ankle is more swollen than the left, this is an extremely common sign that you may have liver damage, and you may want to use a natural remedy to improve its function, but we'll talk more about cleaning your liver later in the video. Jumping back to sign number 4 now, which is white eyelid growths. Another weird sign of liver damage is the appearance of white or yellowish growths around your eyelids. These are small pockets of cholesterol deposits that build up under your skin because your liver isn't breaking down cholesterol properly, causing it to back up into different areas of the body. Sign number 5 is right-sided pressure. Another sign that you may have liver disease is a feeling of pressure or pain on the right side of your rib cage, especially after you eat. Bile from your liver is turning into a sludge because of the liver damage, which is clogging up the little tubes connected to your gallbladder and causes a sensation of pressure and pain around the ribs. This can also put pressure on the phrenic nerve, causing muscle tightness and pain in the area around your right shoulder. Sign number 6 is purple and red spots. When your liver is congested, inflamed, or damaged, it produces less proteins that are needed for normal blood clotting. This means that you can bruise more easily, and quite often unusual purple or red bumps can appear as a rash on the skin, as well as small red patches. This often happens around the lower legs or the arms, and it's caused by the poor blood circulation triggered by liver disease, or possibly diabetes. Next up is cracked heels. Your body uses vitamin B3, commonly known as niacin, to keep your skin cells strong, smooth, and moisturized to prevent it from becoming damaged. If you have liver disease, however, your body uses up its vitamin B3 stores to help repair the damage. This leaves less of the nutrient available for other jobs, causing the skin on the soles of your feet and heels to start cracking. This can be overcome by loading up on vitamin B3 and fixing the root cause of the problem, which is fatty liver disease. Another symptom of liver disease is having the constant urge to scratch or itch the palms of your hands or the soles of your feet. This condition is caused by a buildup of bile acids under the skin, because the liver is not filtering them out properly, and this causes histamines to build up in the blood, causing the itchy reaction. Number 9 is all white or clubbed nails. If your fingernails begin to turn all white in color, losing their pink color, or they take on a rounded, clubbed, or bulbous appearance, this can indicate that there is some serious liver damage or another underlying health condition which is preventing oxygen from reaching the nail matrix. It was discovered in the 1950s that 8 out of 10 people with severe liver scarring had all white nails. Sign number 10 is dark urine. Your liver has the job of breaking down old red blood cells, which contains this yellowish pigment called bilirubin. Now, if your liver or the gallbladder becomes damaged, this pigment can start to build up inside the body, and then it can be flushed through the urine, causing your pee to have a very strong, dark, orange, amber, brown, or cola color, because your liver isn't breaking down the pigment normally. This can also be caused by certain medications that are weakening your liver, like antibiotic, sleeping pills, or birth control pills. 11 is yellowed skin. When your liver isn't working properly and filtering this bilirubin from your blood, the pigment can also start to change the color of your skin. This can cause a yellowish tinge to the skin called jaundice, which is a sign that there is some serious damage in the liver, such as hepatitis, cirrhosis, drug, or medication poisoning. So please, visit your doctor if this is the case. And finally, number 12 is spider veins. Spider veins look like small red dots with spider-like extensions of blood vessels that appear on the skin. These are blood vessels that have become damaged because your liver isn't doing its job in filtering out all of the excess estrogen. High estrogen weakens the blood vessels in the veins, causing them to dilate, and they become visible on the skin. If you have one or more of these symptoms that we've talked about here, it's highly recommended to visit your doctor and ask for an ultrasound test. This is a very simple, non-invasive test which uses sound waves to take an image of your liver and its network of blood vessels to find out if there are any fatty deposits building up inside. Fortunately, the liver is one of the only organs in the body that can completely heal and regenerate. How to reverse liver disease? As I previously mentioned, the liver has 4 different stages of damage. First, it gets clogged up with fat, then it becomes inflamed and begins to develop scar tissue called fibrosis, and then it develops into a more severe, life-threatening stage called cirrhosis. Fortunately, however, the liver has the ability to completely regenerate and heal itself when you fix your diet and use the right remedies. So let's go through the most important steps to reverse liver damage. 1. Clean up your diet by cutting back on sugary, starchy, and flour-based foods, like bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, etc. A fatty or damaged liver is sensitive to fructose, which is fruit sugar, in the same way that it is alcohol, so it's important to stop drinking fruit juices and alcohol entirely. 2. Eat lots of bitter, sulfur-rich foods, like leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasture-raised eggs, wild salmon, and other oily fish, walnuts, onions, scallions, and broccoli sprouts. Foods that are high in sulfur help to strip away fat from your liver by boosting glutathione levels and helping to detoxify poisons. 3. Drink 1 cup of organic coffee that's brewed at home each morning and then add 1 teaspoon of turmeric. The polyphenols found in the coffee and the phytonutrients in the turmeric reduce scar tissue formation in the liver, and they also help it to repair damage caused by alcohol, drugs, or fructose. You should also be drinking at least 1 liter of high-quality mineral water throughout the day, to help thin out your blood and help the liver to produce bile, in order to break down any fatty deposits. You can also add freshly squeezed lemon or lime juice to improve the filtration of toxins in your liver. In fact, I recommend that you get as many liver-cleansing herbs and spices into your diet as possible, such as ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and also cloves. 4. Eat all of your daily calories in a 6-hour window, allowing your body 18 hours to fast each day. I recommend eating all of your food between the hours of 12 p.m. to 6 p.m., but you can change this window to suit your lifestyle. This is what we call intermittent fasting, or timed eating, and it majorly improves the health of your liver by lowering inflammation and increasing insulin-like growth factor, a hormone that helps to prevent fat from accumulating in the liver. Fasting also stimulates autophagy, where your liver recycles old damaged cells and proteins to regenerate new healthy liver cells. 5. Stop eating all of the inflammatory seed oils, such as corn, cottonseed, canola, rapeseed, soy oil, cheaper processed olive oil, margarine, etc. Start eating anti-inflammatory fats instead, like extra virgin olive oil and virgin coconut oil, in your own home-cooked delicious recipes, as these have been proven to have liver protective properties. And finally, to clean out the fatty deposits and to lower inflammation inside the liver, take a purified bile supplement in the morning on an empty stomach. You can use TUDCA, purified bile salts, or a digestive enzyme blend that contains ox bile on the ingredients list. These not only help to eliminate fat from your liver, but they also prevent the formation of gallbladder stones. If you are serious about repairing your liver, there are also other vitamins and supplements that can be used. If you'd like to learn more, tap on this video that's on the screen now for more information. Once again, thank you so much for watching my video today and for your support. Wishing you great health, wealth, and happiness. 11 Early signs of liver cirrhosis. Liver cirrhosis is a serious condition characterized by the accumulation of scar tissue within the liver due to prolonged liver damage. This damage can be induced by various factors, such as a high carbohydrate diet, excessive alcohol consumption, or the overconsumption of sugary foods. Over time, these habits can lead to the deposition of fat in the liver, ultimately resulting in the formation of fibrosis, a precursor to cirrhosis, which can pose a significant threat to your overall health. Often, individuals may remain asymptomatic for many years, even as the liver undergoes progressive inflammation and the gradual replacement of healthy liver cells with scar tissue. This insidious process is sometimes referred to as silent cirrhosis, as it can silently advance without displaying noticeable symptoms. It's worth noting that more than 25% of individuals in the United States suffer from fatty liver disease, underscoring the importance of recognizing the warning signs and symptoms before the condition becomes life-threatening. In this informative video, we will explore 11 early signs and symptoms of liver cirrhosis and liver disease. Additionally, we will provide practical advice on remedies and nutritional strategies to support the healing of your liver if you find yourself affected by this condition. Recognizing early signs of liver damage. 1. Spider angioma. Liver damage can manifest with the development of small, red, spider-like blood vessels, typically appearing on the upper parts of the body. These vessels become compromised due to the liver's reduced ability to filter excess estrogen, resulting in vein dilation and their visibility on the skin. 2. Yellowed skin and eyes. A classic indicator of liver disease is the yellowing of the skin and eyes. Normally, the liver filters out bilirubin, a yellow or orange substance, from the blood. However, liver damage can impede this function, causing an accumulation of bilirubin, and giving rise to the yellowish discoloration of the skin and eyes. 3. Red palms. The presence of red palms, as depicted in the image on the left, may also signal liver damage. Approximately 23% of individuals with liver cirrhosis experience a condition known as palmarerythema, which results from impaired estrogen filtration by the liver, leading to capillary dilation in the hands. 4. Potbelly or ascites. A protruding potbelly can serve as a clear indicator of fat accumulation in the liver, which can progress to scar tissue formation and cirrhosis. In this situation, the liver begins to leak fluid into the peritoneal cavity, causing abdominal distension, akin to a swollen belly with a resemblance to enlarged breasts in some cases. Men with fatty liver disease often develop additional tissue around their chest area, commonly referred to as man boobs. This is a readily identifiable and prevalent early sign of liver damage. As liver inflammation ensues, estrogen levels elevate, leading to the development of female breast tissue. 5. Clubbed fingernails. Impaired liver function can result in thickened and club-like fingernails. This occurs due to the disruption of nutrient absorption in the body, which affects nail health. It's important to note that this condition can also be attributed to heart, lung, or thyroid issues. 6. White growths on the eyelids. Another telltale sign of liver damage is the appearance of white growths around the eyelids, known as xanthomas. These are small accumulations of cholesterol resulting from elevated fat levels in the blood, often associated with compromised liver function. 7. Swelling in the right leg or foot. The liver, situated on the right side of the body, plays a pivotal role in various bodily functions. When liver damage occurs, it can result in localized swelling on the right side, particularly in the lower legs and feet. This condition is referred to as edema, and is characterized by the skin retaining an impression when pressed due to underlying inflammation within the liver. 8. Purple bumps on the skin. An additional concern is the development of flat, purple bumps on the skin, often indicative of a condition known as lichen planus. These skin abnormalities may signal the presence of hepatitis C, a viral infection that targets the liver and provokes heightened activity of liver enzymes. 9. Dandruff. If you frequently notice white flakes on your scalp, it could be a sign of deficiency in specific B vitamins that are stored in the liver. A compromised liver may struggle to utilize these nutrients effectively, leading to scalp issues and flaking. Additionally, impaired B vitamin utilization may also result in cracked skin on the soles of your feet. 10. Ecchymosis. Small purple or red dots that emerge on the skin, particularly on the lower legs or arms, can be associated with liver damage. In cases of liver impairment, insufficient production of clotting proteins can cause these tiny bruises to surface beneath the skin. 11. Chicken skin. Some individuals may develop small red bumps on hair follicles, commonly found on the arms and the front of the thighs. This condition is known as cirrhosis and is primarily attributed to insufficient active vitamin A levels. The liver plays a crucial role in storing vitamin A and producing bile, which facilitates its absorption from the foods we consume. Liver damage can disrupt this mechanism, giving rise to these skin bumps. So, what can be done to enhance liver health? If you're experiencing the symptoms we've just discussed, you'll want to explore steps to initiate the healing process and shield your liver from further harm. 1. Prioritize the consumption of organic cruciferous vegetables. Incorporate an abundance of organic cruciferous vegetables into your diet, including kale, collard greens, broccoli, Brussels sprouts, cabbage, and cauliflower. These vegetables are rich in plant compounds that can mitigate liver inflammation and promote natural healing. 2. Consider digestive enzyme capsules. Consume digestive enzyme capsules before meals, ensuring they contain ox bile or purified bile salts. This helps slow down the progression of liver scar tissue and supports the production of bile necessary for the absorption of essential nutrients like vitamin A and vitamin E. 3. Explore intermittent or prolonged fasting. Practicing intermittent or prolonged fasting can stimulate the generation of stem cells that contribute to liver tissue regeneration. This fasting approach also reduces inflammation within liver cells and serves as a preventative measure against further scarring. 4. Eliminate sugar and alcohol. Remove sugar and alcohol from your diet as they are known culprits behind liver disease and cirrhosis. Alcohol directly harms liver cells, leading to inflammation and scarring, while sugar, especially fructose found in sugary beverages, has a similar damaging effect. 5. Harness the power of liver-supporting herbs. Incorporate potent herbs that support liver health into your routine. Milk thistle, containing silymarin, is a noteworthy choice as it acts as a robust antioxidant, fortifying liver cells and aiding in their regeneration, especially in the face of damage from alcohol, drugs, and sugar. We also recommend tocotrienols, a potent form of vitamin E, which can reduce scar tissue in the body. Additionally, consider including turmeric, garlic, serrapeptase, and fresh ginger in your regimen. Following these steps can safeguard your liver from further harm and promote its recovery from existing damage. In summary, the liver is a vital organ performing over 500 essential functions to maintain your well-being. By recognizing the early signs of liver damage shared in today's video, you can initiate positive lifestyle changes to enhance your health. These actions can reduce liver inflammation, often leading to healthy weight loss and a reduction in scar tissue. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Say goodbye to gallstones, 5 vitamins that can help dissolve them. Gallstones is those hardened, pebble-like formations that can develop within your gallbladder, often disrupt the natural flow of bile from the gallbladder to the small intestine. This disruption can result in discomfort and bloating, particularly on the right side beneath your rib cage. To understand this better, your gallbladder, a small sac position just beneath your liver, plays a vital role. It stores and concentrates bile, a fluid produced by the liver. When you consume food, the gallbladder contracts, releasing bile into the small intestine to aid in the digestion and absorption of fats. Unfortunately, bile in the gallbladder can become thicker over time, leading to the formation of hard crystallized cholesterol stones, which obstruct the bile flow. Consequently, you may experience pain and pressure beneath the right side of your rib cage, just above the gallbladder, as it becomes inflamed and obstructed. Additionally, you might feel tightness and discomfort in your right shoulder or between your shoulder blades due to the pressure exerted by the irritated gallbladder on the phrenic nerve. Some individuals may also experience nausea or vomiting after consuming fatty foods because insufficient bile is released to facilitate fat digestion. It's crucial to recognize that gallbladder stones primarily become problematic when there's an inadequate release of bile salts from the liver. This causes the cholesterol within the bile to thicken into a sludge, eventually crystallizing into stones. At times, these stones can become lodged in the small ducts connected to the gallbladder, intensifying the issues and discomfort. If you have numerous gallstones, your doctor might recommend surgical removal of the gallbladder. However, if there are only a few stones present, it may be possible to dissolve them through dietary improvements and enhancements in bile flow and quality. In this presentation, we will explore 5 key vitamins and nutritional supplements that can assist in dissolving gallstones and thinning the bile to prevent the formation of additional gallstones. It's important to note that when we refer to vitamins, we are using the term broadly to encompass nutritional supplements and nutrients that can aid in dissolving gallstones or gallbladder sludge. The first supplement to consider is bile acids. To help regulate the production of bile in your liver, you can incorporate a daily bile acid supplement into your routine, taking it 4 times a day. Ideally, take 2 capsules in the morning on an empty stomach, 1 before your first meal, and 1 before your second meal of the day. Bile acids play a vital role in thinning and enhancing the quality of the bile released by your liver into your gallbladder. This action aids in breaking down cholesterol crystals and stones while preventing the formation of new ones. Bile supplements can also improve your ability to digest fatty foods, reducing the likelihood of bloating. Additionally, they enhance the absorption of fat-soluble nutrients such as vitamins A, D, E, K, and K2, as well as phytonutrients found in vegetables. When searching for a product, carefully read the labels and opt for a brand that contains ox bile, bovine bile concentrate, or purified bile salts among its ingredients. Number 2 is virgin cod liver oil. It is highly recommended to take 1 to 2 teaspoons of virgin cod liver oil daily if you have gallbladder inflammation, stones, or biliary sludge. Cod liver oil is an excellent source of omega-3 fatty acids, known for their ability to reduce inflammation in the liver and gallbladder, as well as to thin out bile sludge, facilitating its passage through the ducts to the small intestine. If you frequently experience bloating, discomfort between your shoulders, or pressure under your right ribcage after eating, you may find relief by incorporating virgin cod liver oil into your regimen after 1 to 2 weeks. It is essential to include healthy fats in your diet by consuming oily fish, grass-fed butter, and extra virgin olive oil. These fats signal your gallbladder to release bile and prevent it from thickening into sludge or cholesterol stones. Now, moving on to number 3, vitamin B9, also known as folate. Many individuals with gallbladder issues have been shown to have a deficiency of folate in their blood work. Folate is crucial because it is required by your liver to synthesize new bile acids from cholesterol in your body. Folate deficiency often occurs due to inadequate consumption of folate-rich foods. You can choose to take 1,000 micrograms of methylfolate daily to support your liver and gallbladder in producing healthy bile and preventing new stone formation. Alternatively, you can obtain folate naturally from foods like beef liver, leafy greens, asparagus, and Brussels sprouts. These foods also contain sulfur and other phytonutrients that aid in liver detoxification, further promoting bile flow and gallstone dissolution. Number 4, vitamin C. The vitamin C complex plays a crucial role in supporting the immune system and guarding against inflammation and oxidative damage. What many people are unaware of is that vitamin C assists your liver and gallbladder in converting cholesterol into bile acids by activating an enzyme known as 7-alpha-hydroxylase. Insufficient vitamin C intake from raw fruits and vegetables can lead to a decrease in bile acid concentration, potentially resulting in gallstone formation. It is recommended to avoid over-the-counter ascorbic acid supplements, as they are not the true form of vitamin C. Instead, focus on increasing your intake of natural vitamin C-rich foods such as lemons, limes, various types of peppers, sauerkraut, cabbage, berries, and leafy greens. If you wish to supplement your vitamin C intake, you can opt for freeze-dried acerola cherry powder, which can be mixed into a glass of water or a smoothie. This powder is one of the richest natural sources of the vitamin C complex. Turning our attention to the final nutritional supplement in this video, probiotics. As your body digests food, bile, released from your gallbladder, enters the small intestine, where it plays a crucial role in breaking down fats and facilitating nutrient absorption from the food. During this process, some of the bile acids are reabsorbed and sent back to the liver for recycling, ensuring the proper function of your gallbladder. Here's where friendly bacteria, or probiotics, come into play within your gut. They aid in this digestive process and even produce bile acids themselves, promoting the smooth flow of bile and preventing the formation of gallstones. To incorporate more probiotics into your daily diet, consider consuming foods like kefir, sauerkraut, kombucha, tea, kimchi, serene, and other fermented vegetables. Alternatively, you can opt for a liquid probiotic supplement, ensuring it contains a minimum of 50 billion colony-forming units with a variety of friendly microbial strains. In the later part of this video, we'll explore 6 actionable steps to help dissolve gallstones. But before that, let's delve into some of the underlying causes that may lead to the formation of gallstones in the first place. The primary culprit is often a fatty liver resulting from excessive consumption of junk foods, alcohol, or vegetable oils. This inflammatory condition in the liver can lead to the crystallization of cholesterol stones in the gallbladder due to poor bile quality. Another common contributor, affecting both men and women, is an excess of estrogen. Women may experience this from birth control pill usage or during pregnancy, while both sexes can be affected by being overweight or consuming estrogenic foods like soy protein. Emotional stress is another factor that can disrupt hormonal balance and bile acid recycling, potentially leading to gallstone development. Additionally, insufficient intake of bitter vegetables, celiac disease, antacid use disrupting digestive juices, or adherence to a low-fat diet hindering bile release can all contribute to gallbladder sludge or stone formation. Now that we've covered these factors, let's explore the 6 actionable steps to dissolve gallstones and restore proper bile function. 1. Incorporate daily bile acid supplements to cleanse the liver, enhance your bile's quality, and prevent new cholesterol stones while dissolving existing ones. 2. Ensure proper hydration by drinking at least 1 liter of mineral water daily, as insufficient fluids can lead to cholesterol crystallization in bile. 3. Consume bitter herbs such as milk thistle, ginger, dandelion root, turmeric, golden seal, and artichoke to stimulate gallbladder bile release and thin out sludge. Additionally, include cruciferous vegetables like radish, radicchio, chicory, arugula, asparagus, Brussels sprouts, and cabbage to support liver and gallbladder health. 4. Manage stress and cortisol levels through relaxation techniques like long walks, aromatherapy, guided meditations, breathing exercises, and improved sleep, as cortisol negatively impacts the gallbladder. 5. Incorporate omega-3 rich foods into your diet, such as wild salmon, sardines, mackerel, shellfish, anchovies, pasture-raised eggs, and grass-fed beef, to reduce inflammation in the liver and gallbladder, promoting bile flow and preventing further thickening and crystallization. 6. Given that many gallstone issues originate in the liver, consider exploring techniques to cleanse and detoxify your liver. These steps can help you on your journey to dissolving gallstones and restoring proper bile function. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. The Ultimate Fatty Liver Detox, Top 10 Foods for Regeneration. Your liver, a vital organ in the human body, plays a crucial role in maintaining your health. It tirelessly filters your blood, synthesizes hormones, and detoxifies harmful substances from your surroundings. Unfortunately, the prevalence of fatty liver disease is alarming, affecting more than 1 in 3 individuals. This condition involves the accumulation of fat within the liver, which places undue stress on the body's intricate systems. Fatty liver disease can give rise to a multitude of health issues, such as hypertension, hormonal imbalances, abdominal weight gain, diabetes, pruritus, itchy skin, bloating, and a compromised immune system, among others. In a previous video, we discussed the 10 foods that contribute to liver damage and the accumulation of fat. Today, our focus shifts to a more positive note as we delve into the top 10 foods that can effectively cleanse and support liver regeneration, aiding in its natural healing process. Number 1 is allium vegetables. These include garlic, onions, shallots, chives, leeks, and scallions. Incorporating these into your meals can help cleanse your liver and eliminate toxins from your blood. Alliums are abundant in sulfur compounds, responsible for their distinctive aroma. Sulfur plays a vital role in bile production, acting as the detergent that breaks down fat and toxins during detoxification. By boosting bile production, these vegetables aid in dissolving harmful substances like caffeine, alcohol, pesticides, plastics, and drugs, ultimately excreting them through stool or urine. Number 2 is eggs. Our second food group, eggs, deserves a special mention. Consuming at least 2 pasture-raised eggs daily can reduce liver inflammation and fat accumulation. Eggs are an excellent natural source of choline, a nutrient crucial for strengthening liver cell membranes and enhancing liver function. Choline also supports digestion and brain health. To preserve the delicate nutrients in the yolk, consider cooking your eggs sunny side up or soft-boiled. Unlike protein powders and bars that can strain the liver due to their challenging digestion, eggs provide all 9 essential amino acids, making them easy for the liver to process, contributing to muscle and bone health. Number 3 is cruciferous vegetables. Our third group is the cruciferous vegetables, rich in minerals, antioxidants, and phytonutrients beneficial for liver health. Broccoli, cauliflower, radishes, mustard greens, beets, arugula, Swiss chard, kale, collard greens, and cabbage are among the recommended options. These vegetables stimulate the liver to produce glutathione, a potent antioxidant that supports cell regeneration and DNA protection. Including these vegetables in your daily diet can help eliminate liver fat effectively. Number 4 is microgreens. Microgreens, sprouted seeds like cress, broccoli, and arugula sprouts, are our fourth recommendation. These tiny powerhouses contain up to 100 times more sulforaphane than mature vegetables, aiding in the detoxification of cancer-causing compounds. Microgreens also contain myrosinase, an enzyme that facilitates the absorption of vitamin C and sulforaphane. Grow them at home with a sprouting kit, using seeds from cruciferous vegetables, particularly broccoli and radish seeds. Sprinkle these sprouts over your salads and cooked vegetables to boost your liver's cleansing abilities. Up next are some herbs and spices. Many phytochemicals found in these natural ingredients enhance liver function. Freeze-dried milk thistle improves bile production, aiding in fat removal from the liver. Turmeric, with its active compound curcumin, reduces inflammation and oxidative stress in liver cells. Rosemary contains rosmarinic acid, a potent antioxidant that shields the liver from toxins. Fennel helps prevent the formation of gallbladder stones by thinning bile. Cinnamon regulates blood sugar levels and prevents fat accumulation in the liver. Dandelion flowers or roots enhance bile production for detoxification, and morina powder binds to heavy metals, facilitating their removal through the liver. Incorporating these liver-cleansing foods into your diet can significantly improve your liver's health and overall well-being. Now, moving on to the sixth point, let's the benefits of incorporating green or peppermint tea into your daily routine. It's crucial for your liver to maintain proper blood viscosity to effectively filter toxins. To support liver hydration, consider drinking at least 1 liter of mineral water daily to promote optimal blood flow. Additionally, sipping 1 or 2 cups of peppermint tea, preferably in the morning, can be beneficial. Peppermint tea contains menthol, which relaxes the muscles in the bile ducts and gallbladder, facilitating the flow of bile. This, in turn, aids in the absorption of essential vitamins and detoxification of harmful substances in your body. Another excellent option is green tea, known for its high catechin content. Catechins have anti-inflammatory properties that can reduce liver inflammation, ensuring it functions optimally. And now food number 7 is berries. Sadly, more than 80% of processed junk foods contain high fructose corn syrup, a concentrated fruit sugar that can contribute to liver fat accumulation and liver disease. However, the fruit sugars in natural berries are easier for your liver to process due to their concurrent supply of vitamin C and other phytochemicals. So, if you aim to reverse fatty liver disease, steer clear of refined foods and overly sweet fruits. Instead, incorporate a cup of berries into your daily regimen. Options like blackberries, strawberries, blueberries, raspberries, and gooseberries are not only delicious but also provide a satisfying alternative to sugary treats. You can even blend them with water and add a few drops of stevia for a delightful, healthy beverage that replaces those harmful sodas. Next on our list are sauerkraut and kimchi, fermented cabbage-based foods. These fermented vegetables are not only rich sources of vitamin C but also harbor live probiotic bacteria that can establish a beneficial presence in your gut. Vitamin C enhances glutathione levels in the liver, while probiotics aid in bile recycling, preventing constipation, and promoting a toxin-free colon. Number 9 is healthy fats. Now, let's discuss the importance of incorporating healthy fats into your diet. Many of the nutrients that aid in liver cleansing are fat-soluble, meaning they require bile for absorption. To ensure optimal absorption, it's essential to include healthy fats in your meals. Consider drizzling extra virgin olive oil over your salads or adding avocados or grass-fed butter. These fats stimulate the release of bile from your liver and gallbladder, helping you absorb liver-cleansing phytonutrients more effectively. Finally, in Section 10, we'll briefly mention other foods that can contribute to liver health, which you may want to explore further. Asparagus and celery contain luteolin, which can reduce liver fat and scar tissue. Mushrooms are rich in glutathione, a potent antioxidant. Cooked tomatoes contain lycopene, which supports liver health. Lemons and limes provide citrates that aid in detoxification. Capers contain resveratrol, another powerful antioxidant. Pomegranate seeds contain ellagic acid, which is beneficial. Carrots are a source of beta-carotene, which can enhance immune function. Additionally, fasting within a smaller time window each day, such as between 12 to 6 p.m., can stimulate liver regeneration, helping to remove liver fat and scar tissue by recycling old proteins. Opting for non-GMO organic vegetables is advisable, as they are less likely to be contaminated with harmful pesticides and chemicals that could harm your liver. Furthermore, eliminating sugar and vegetable oils from your diet is crucial to reduce the strain on your liver and support its healing process. Lastly, be aware of toxic ingredients in modern foods that may hinder liver recovery. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Repairing your liver, top 8 vitamins to include in your diet. The liver stands as a cornerstone in the intricate machinery of the human body, processing a staggering 1.7 liters of blood each minute. Its role in maintaining overall health cannot be overstated. To ensure your well-being, it is imperative to prioritize the nourishment of your liver by incorporating the right foods and essential nutrients into your diet. By doing so, you enable this vital organ to effectively neutralize toxins, rendering them harmless. Among its multifaceted responsibilities, the liver manufactures bile to facilitate the removal of waste and break down dietary fats. Furthermore, it serves as a repository for fat-soluble vitamins, including A, D, E, K, and B12, in addition to orchestrating over 500 other critical bodily functions. Regrettably, if you are overweight, there is a high probability that your liver is congested, harboring fatty deposits that impede its optimal functioning. Over time, a fatty liver can lead to further complications such as weight gain, elevated blood pressure, heart attacks, strokes, and ultimately, liver cirrhosis. Fortunately, nature provides us with a repertoire of vitamins and compounds that can not only repair existing liver damage, but also bolster its multifaceted roles in safeguarding your health. In this discourse, I employ the term vitamins broadly, encompassing amino acids, enzymes, and natural remedies, all of which contribute to the revitalization of your liver. Before delving into the specifics of these beneficial nutrients, it is essential to be vigilant and recognize potential signs of liver distress. These indicators can serve as valuable early warnings. Individuals afflicted with a fatty liver often experience discomfort and tenderness in the right shoulder region due to the pressure exerted by the congested liver on the phrenic nerve. Additionally, post-meal sensations of pressure or fullness beneath the right rib cage may manifest, hinting at a deficiency in bile production, a topic we will explore further in this presentation. Liver-related issues may also manifest as swelling in the right foot and ankle. Furthermore, the presence of spider veins on the skin can be attributed to the toxic accumulation of hormones within the liver. Lastly, abdominal obesity is a telltale sign that fat has infiltrated the liver, spilling over into the abdominal cavity. While these are some of the more common symptoms associated with liver problems, it is important to note that there are numerous other indicators one should remain vigilant of. The initial and arguably the most crucial nutrient for liver health is choline. Choline gained recognition as an indispensable component of our diet back in 1998, when researchers unveiled its pivotal role in preventing fatty liver disease and mitigating muscle damage. Incorporating a daily supplement of 300 milligrams of CDP choline into your regimen can be instrumental in eradicating unwelcome fat deposits from the liver, thereby averting or even reversing fatty liver disease. This is primarily achieved by enhancing the composition of bile produced within the liver. Bile essentially functions as a detergent in the body, facilitating the dissolution and breakdown of dietary fats. Alternatively, you can also boost your choline intake by including foods such as beef liver, organ meats, eggs from pasture-raised hens, cauliflower, broccoli, Brussels sprouts, cabbage, and dairy products sourced from grass-fed animals into your diet. The second element on our list is methionine. Now, methionine is a sulfur-based amino acid, a crucial building block for various bodily functions, particularly liver health. It plays a pivotal role in aiding the liver's self-repair mechanism, facilitating the detoxification of harmful substances within your body, including substances like acetaminophen, which can pose a threat when taken in excess. Some of the most potent sources of methionine include eggs, sesame seeds, Brazil nuts, grass-fed cheese, chicken, and tuna. By incorporating these into your diet, you're essentially providing your liver with the necessary components to enhance its production of glutathione, an exceptionally potent antioxidant. Glutathione operates as a formidable ally in reducing inflammation not only within the liver but also throughout your entire body. This reduction in inflammation can lead to decreased pain and swelling in your joints, as well as aiding in the breakdown and elimination of alcohol from both the bloodstream and the liver. Moreover, it actively contributes to the production of crucial neurotransmitters in your brain, thereby promoting overall cognitive well-being. Moving forward, let's delve into bile salts. As mentioned earlier, your liver is responsible for producing bile, a vital liquid that aids in the digestion and breakdown of dietary fats into smaller, more absorbable particles. This process is essential for the absorption of fat-soluble vitamins such as A, D, and E, alongside other fat-soluble nutrients. Regrettably, in cases of liver damage, bile can transform into a viscous substance, often referred to as sludge, exerting pressure on your gallbladder and bile ducts. To counter this, incorporating a daily supplement of bile salts and digestive enzymes into your regimen can effectively thin out the bile and help dislodge fatty deposits within your liver. Now, let's return to number 4, which involves a noteworthy phytonutrient known as sulforaphane. Sulforaphane is a crucial compound found abundantly in cruciferous vegetables like broccoli, Brussels sprouts, radishes, cabbage, cauliflower, and kale. Inflammation within the liver can potentially lead to complications such as insulin resistance, diabetes, cancer, and other life-threatening ailments if left unaddressed. However, a regular intake of raw cruciferous vegetables can serve as a formidable ally in mitigating inflammation. By supporting optimal liver function, sulforaphane actively aids in detoxifying the liver from the accumulated residues of caffeine, medications, environmental chemicals, and toxins. It's imperative to note that cooking these vegetables can diminish the enzymatic activity required to activate sulforaphane in your body. Therefore, whenever feasible, opt for raw consumption. An intriguing fact to consider is that broccoli sprouts, cauliflower sprouts, and radish sprouts contain approximately 100 times more accessible sulforaphane compared to their fully grown counterparts. So, go ahead and incorporate these sprouts into your salads to witness substantial enhancements in your overall health. Number 5 on our list focuses on tocotrienols, a subtype of vitamin E. Over time, liver damage can lead to the accumulation of scar tissue, hindering the proper functioning of liver cells. Tocotrienols, found naturally, offer a solution by reducing scar tissue not only in the liver but throughout the body. Consider incorporating tocotrienols into your daily routine via a supplement derived from natto, a soybean-based product. These remarkable compounds not only dissolve liver scar tissue but also serve as potent antioxidants, aiding in the repair of liver injuries and mitigating inflammation, thus preventing further harm. Moving on to number 6, we have the spice turmeric. Curcumin, a component of turmeric, possesses powerful anti-inflammatory properties that are beneficial for the liver and the body as a whole. It's often hailed as a natural painkiller due to its ability to boost antioxidant activity in the liver. Taking a daily 2,000 mg turmeric supplement can assist the liver in detoxifying heavy metals like lead, mercury, and cadmium, while also promoting liver regeneration. Now, don't underestimate the importance of number 7, vitamin D. A deficiency in vitamin D can contribute to the development of fatty liver disease. Our skin synthesizes vitamin D when exposed to sunlight. Given the widespread deficiency in this vitamin worldwide, it may be prudent to supplement with 10,000 international units of vitamin D3 daily. Vitamin D3 not only reduces liver inflammation and swelling but also enhances bile production. This naturally leads to a reduction in liver fat, fibrosis, scar tissue, and aids in the treatment and prevention of hepatitis, a viral infection that affects the liver. Lastly, the crown jewel of liver protection is glutathione, the master antioxidant produced by your liver. You can also increase your glutathione levels by including certain foods in your diet, such as turkey tail mushrooms, oyster mushrooms, avocados, and asparagus. Glutathione plays a pivotal role in safeguarding your entire body from free radical damage, making it crucial for maintaining a healthy liver. To support your liver health, consider these 3 steps. Incorporate sulfur-rich foods like cabbage, cruciferous vegetables, garlic, onions, bone broth, grass-fed beef, walnuts, and watercress into your diet. These foods elevate glutathione levels, offering protection against free radical damage in the liver. Consume selenium-rich foods like Brazil nuts, tuna, sardines, halibut, eggs, and organ meats to further boost glutathione levels. Integrate whole milk thistle powder into your daily routine, taking it 3 times a day. This herbal remedy is among the best natural substances for increasing glutathione levels and aiding in the recovery from fatty liver disease, fibrosis, and inflammation. Now, let's discuss foods that should be avoided, as they can harm the liver. Stay away from vegetable oils like corn, soy, cottonseed, and canola oil, as these can trigger significant inflammation within liver cells. Eliminate sugar and corn syrup from your diet, as they deplete your antioxidant reserves, rendering your liver more susceptible to inflammation and infection. Alcohol is another culprit, damaging hepatocytes and increasing the risk of cirrhosis and cancer. Furthermore, be cautious with painkillers like acetaminophen or paracetamol, as they can poison the liver and deplete glutathione levels. While not a food, concentrated protein powders and power bars can also cause liver cell damage, particularly when consumed without adequate fat, leading to an ammonia buildup. In summary, your liver is a remarkably resilient organ capable of self-repair and restoration, even after experiencing liver disease. To help your liver recover, consider incorporating a combination of the nutrients and antioxidants discussed here. Additionally, adopting an intermittent fasting plan such as OMAD, where you consume all your calories within a shorter time window, can stimulate a process called autophagy, facilitating the removal of old and damaged liver tissues, promoting liver cell health. Finally, adopting a low-carbohydrate diet and increasing your intake of raw cruciferous vegetables can be an exceptionally effective way to cleanse and rejuvenate your liver. To learn more about this topic, please like the video and subscribe to my Healthy Care channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Welcome to our latest video where we dive into this important health warning that can save your liver and prolong your life. Every day, many of us consume foods that gradually degrade the liver, the vital organ responsible for detoxifying the body, without even realizing it. In this video, we'll explore 6 common foods that are common in your kitchen and that are enemies to your liver health. From the snack you love to the main dish you can't live without, it's time to expose the hidden dangers. Be sure to watch until the end to learn how to protect and preserve liver health with some life-changing dietary tweaks. Don't miss out, your liver's future could depend on it. 1. Processed meats. Yes, we're talking about salami, sausages, hot dogs, Parma ham, and even that seemingly innocent turkey breast. While they may be staples in your diet, these foods are loaded with preservatives like nitrates and nitrites, which have been scientifically linked to an increased risk of serious health issues, including various types of cancer such as intestinal, stomach, and colorectal cancer. But it's not just about the risk of cancer. These meats can also contribute to liver damage due to high fat content and the burden of processing those preservatives. So, what should you do? If completely cutting out these foods seems daunting, start by reducing your intake as much as possible. Making this change is a powerful step towards safeguarding your liver and enhancing your overall health. 2. Avoid simple sugars. The impact of sugars goes deeper, especially if you are dealing with liver issues like hepatic steatosis, commonly known as fatty liver disease. When you consume simple sugars, whether it's refined sugars in desserts or hidden sugars in beverages, they cause your blood sugar levels to spike, necessitating a surge in insulin. This isn't just a problem for your pancreas. It's a direct stressor on your liver, exacerbating conditions like fatty liver. Simple carbohydrates behave much like simple sugars in your body. Foods such as white bread, pasta, and cakes quickly break down into sugars during digestion, continuing the cycle of spikes and stress on your liver. Remember, it's not all carbs that are the enemy. Complex carbohydrates like whole grains are beneficial. However, it's crucial to steer clear of those simple sugars and refined carbs to protect your liver and maintain optimal metabolic health. So, next time you're about to reach for that white bread or pasta, think about the longer-term impact on your liver's health. 3. Food with high sodium index. Think about the last time you reached for that convenient packet of instant noodles, or grabbed a frozen lasagna from the supermarket freezer. While these items promise quick satisfaction and comfort, they are actually packed with preservatives and high levels of sodium which can be detrimental to your liver health. The problem extends to many sauces and condiments as well, even the ketchup and mustard that might be staples in your fridge. These often contain not just high sodium but also a plethora of preservatives that can further tax your liver. The takeaway here is simple but crucial: avoiding these types of foods is just as important as selecting healthy ones. While it might seem challenging to cut these convenient options out of your diet, understanding their impact can motivate you to make healthier choices. 4. High saturated fats in foods. This might come as a surprise, especially when we talk about something as widely praised as coconut oil. Despite its popularity and the myriad of health benefits claimed online, coconut oil is actually high in saturated fats. If you're dealing with fat accumulation in your liver,
it's particularly important to avoid these kinds of fats. Scientific research has shown that saturated fats, like those found in coconut oil, can worsen inflammation and increase fat deposits in the liver. This is not just about coconut oil, though. Let's also talk about another beloved treat, ice cream. Delicious as it may be, ice cream is another source of saturated fat that can be harmful to your liver health. It's essential to limit these types of foods in your diet. Number 5 on our list, and perhaps one of the most well-known but critically important tips for maintaining liver health, alcohol and alcoholic beverages. While many are aware of this advice, its importance cannot be overstated. Alcohol has a direct and detrimental impact on the liver, significantly exacerbating conditions like hepatic steatosis, which is the accumulation of fat within the liver. This is especially true if the liver fat is linked to specific causes or underlying conditions. In such cases, the recommended alcohol consumption should be 0. Completely eliminating alcohol from your diet and daily routine isn't just a suggestion, it's a necessity for those looking to preserve their liver health. If you're uncertain about how alcohol affects your metabolism and overall body functioning, consulting with a specialist can provide you with tailored advice and deeper insights. 6. Corn syrup. Often touted as a cheaper sweetener in countless processed foods, fructose syrup is considered by many experts to be one of the worst offenders for liver health. The reason is scientific and quite clear. Fructose syrup has been shown to significantly exacerbate hepatic steatosis, which is the medical term for the accumulation of fat in the liver. This isn't just a minor issue, it's a major risk factor for developing more serious liver conditions. The key action here is vigilance. Always check food labels when shopping and be cautious about what you're putting into your body. By avoiding or restricting your consumption of foods containing corn syrup or fructose syrup, you're taking a significant step toward protecting your liver from further damage. This simple change can make a substantial difference in maintaining a healthy liver and overall well-being. Focusing on the best habits to enhance liver health is just as crucial as knowing what to avoid. Here's a rundown of the best habits you can adopt to keep your liver functioning optimally. 1. Control weight. A balanced approach. This tip is absolutely critical for those dealing with liver health, particularly with conditions like fatty liver disease. It might seem intuitive that losing weight quickly would help combat liver fat, but surprisingly, this can actually exacerbate the problem. Rapid weight loss can lead to drastic changes in your body that might cause liver stress and even lead to necrosis, or the death of liver cells. This paradoxical effect can be confusing and disheartening, leading some to abandon their treatment plans out of frustration or a belief that their efforts are counterproductive. However, the key to successful liver health management is gradual weight control. The American Diabetes Association recommends a moderate weight loss of up to 1 kilogram per week as ideal for maintaining liver health. Aiming for a steady reduction of about 0.5 to 1 kilo per week helps avoid the dangers associated with rapid weight loss. Losing 10 kilos in a month, while impressive, is not advisable for those concerned with liver health. Instead of restrictive diets that promise quick results, individuals with liver issues should focus on adopting a balanced and sustainable approach. This includes eating a healthy diet, engaging in regular physical activity, and making gradual lifestyle changes that support long-term health and well-being. This approach not only supports liver health but also promotes overall durability in your treatment and lifestyle changes. 2. Incorporate physical exercise into your routine. It's vital to understand the significant role that physical exercise plays in managing liver health, especially when it comes to treating conditions like liver fat. Engaging in regular physical activity isn't just about building muscle or improving endurance, it's fundamentally important for enhancing insulin resistance and metabolism, both of which are crucial in combating liver fat. When we talk about exercise, remember, it's not limited to the gym. Simple activities such as walking can be incredibly beneficial. Research supports that walking for at least 150 minutes a week, spread over 3 or more days, can significantly aid in reducing liver fat. For instance, you could walk for 50 minutes 3 times a week, or 30 minutes 5 times a week. Both schedules are effective. Particularly for those with grade 1 and 2 liver fat, regular physical activity can potentially reverse the condition. While more severe stages, like grade 3, may not be as easily reversible, maintaining an exercise regimen is still a considerable step forward in treatment. It helps prevent the condition from worsening and can improve overall liver function. Don't feel confined to just one type of exercise. Variety can help keep you motivated and active. Besides walking, consider incorporating other activities like water aerobics or running into your routine. The key is to find what you enjoy and what fits into your lifestyle, making it easier to stick with it over the long term. If you haven't started exercising yet, now is the time to begin. If you're already on this path, keep up the great work, it's making a positive difference in your health. 3. Seek regular medical follow-up. For anyone diagnosed with liver fat, it's imperative not just to focus on the liver itself but also to consider the broader spectrum of metabolic health. Liver fat often does not exist in isolation. It can be associated with several other metabolic disorders that can exacerbate the condition, such as changes in cholesterol levels, high blood pressure, and even hypothyroidism. Regular medical follow-up is essential. During these checkups, your healthcare provider can monitor your overall health, adjust treatments as necessary, and check for any other conditions that might be impacting your liver health. Effective management of these associated conditions is crucial in the overall treatment and improvement of liver fat. By regularly consulting with healthcare professionals, you ensure that all aspects of your health are addressed, which can significantly enhance the effectiveness of your treatment plan. This holistic approach not only helps in treating liver fat but also improves your overall metabolic health, reducing the risk of complications and promoting a healthier future. Therefore, assessing and controlling thyroid function as well as other risk factors I mentioned is the foundation in treating and managing the health of people with fatty liver disease. And what are the best foods? Let's find out it now. 1. Consume low glycemic index fruits. Despite popular myths that might have reached you via the internet suggesting that fruits are forbidden for those with liver fat, the truth is quite different. It's essential to clear up any confusion and provide accurate guidance on this matter. Fruits, in general, do not hinder the treatment of hepatic steatosis or the inflammation associated with liver fat. In fact, low glycemic index fruits such as guava, strawberry, and avocado can be particularly beneficial. These fruits do not cause a rapid spike in blood sugar levels, and can even aid in reversing liver fat thanks to their fiber content and essential nutrients. Thus, such fruits are not only safe but recommended for inclusion in your diet. However, when it comes to fruit juices, caution is needed. Juices like orange or grape juice are generally not advised for those with liver fat. When you drink juice instead of eating the whole fruit, you miss out on a lot of the beneficial fibers, and the sugars in the juice become highly concentrated, which can negatively affect your blood sugar levels. Even whole fruit juices, which retain more of the fruit's fibers than regular juices, can still lead to elevated blood sugar levels and should be consumed sparingly. Therefore, it's better to stick to whole, low glycemic index fruits and avoid fruit juices to manage liver health effectively. Are we clear on this? 2. Consume coffee. Coffee, often hailed as one of the world's favorite beverages, holds numerous health benefits that extend beyond mere wakefulness. It's particularly notable for those concerned with liver health, including conditions like liver fat and diabetes. Research consistently shows that coffee consumption can have protective effects against metabolic disorders. One significant study highlighted that individuals who drank coffee had a 33% lower risk of developing type 2 diabetes. Moreover, coffee has been studied for its potential benefits in managing steatohepatitis, an inflammatory liver condition caused by excessive fat accumulation. For those who enjoy filtered coffee, the general recommendation is about 3 cups per day, with each cup containing roughly 100 milliliters of caffeine. If you prefer espresso, up to 3 or 4 30 milliliter shots daily is advisable, as each shot contains approximately the same amount of caffeine. Proper storage of coffee. To maximize the benefits derived from coffee, it is crucial to store it correctly, considering 3 main factors. Oxygen. Exposure to air can oxidize coffee, leading to nutrient loss, though caffeine content remains unaffected. It's essential to keep coffee in an airtight container to prevent oxidation. Light. Store coffee in a dark container or retain it in its original packaging to shield it from light, which can degrade its quality. Moisture. Keep coffee in a dry environment to prevent moisture from compromising its freshness and flavor. The potential benefits of coffee in liver health can be attributed to its rich antioxidant content, including tocopherol, vitamin E, flavonoids, and polyphenols. These compounds are thought to contribute to coffee's anti-inflammatory and hepatoprotective properties. While definitive scientific conclusions are yet to be drawn on which specific components of coffee improve liver conditions like steatohepatitis, the existing evidence strongly supports coffee as a beneficial part of a liver-friendly diet. 3. Consume fish. Fish is a fantastic source of omega-3 fatty acids, a type of healthy fat that plays a crucial role in overall health, including liver function. Omega-3s are particularly beneficial for managing conditions like liver fat, thanks to their anti-inflammatory properties. Among the top choices for omega-3 rich fish are tuna, salmon, and cod. These species are celebrated for their high levels of beneficial fats and can significantly contribute to a liver-friendly diet. However, it's also important to make informed choices regarding the fish you consume, considering both environmental sustainability and health factors like mercury content. For instance, tuna and salmon can vary in their mercury levels based on factors such as species, example albacore tuna, and whether they are wild-caught or farmed. These considerations are essential for minimizing potential health risks associated with mercury exposure. Furthermore, the preparation method of fish matters greatly. To gain the most health benefits, opt for cooking methods that preserve the integrity of the fish's nutrients. Grilling, baking, or steaming are excellent choices that avoid the extra fats and health risks associated with frying. Incorporating a variety of fish, such as sardines, tuna, salmon, and cod, into your diet not only diversifies your nutritional intake but also provides a rich source of omega-3s, which support liver health and enhance overall well-being. 4. Consume anti-inflammatory foods. Including foods with anti-inflammatory properties in your diet is a pivotal step toward enhancing health and preventing a variety of chronic diseases. These foods are crucial not only for reducing inflammation, which is linked to conditions such as arthritis and fatty liver disease, but also for preventing heart disease and managing diabetes. Many scientific studies support the health benefits of anti-inflammatory foods. Here are some powerful examples to incorporate into your diet: colorful fruits and vegetables. Opt for strawberries, blueberries, oranges, and dark leafy greens like spinach and kale. These are loaded with antioxidants and phytonutrients that actively combat inflammation. Spices and herbs. Include turmeric, which contains the active compound curcumin, ginger, garlic, and basil in your meals. These are not only flavorful but are also renowned for their anti-inflammatory effects. Teas, particularly green tea, which is rich in epigallocatechin gallate, EGCG, a potent antioxidant known for its anti-inflammatory properties. Whole grains, foods like oats, quinoa, and brown rice are beneficial in reducing inflammation. They provide fiber, which helps in maintaining a healthy gut, thereby reducing inflammatory responses in the body. 5. Consume extra virgin olive oil. Extra virgin olive oil is a cornerstone of the Mediterranean diet, renowned for its numerous health benefits, including its potential role in managing liver health. Scientific studies have highlighted the benefits of incorporating this type of oil into your diet, especially for those struggling with liver fat. If you're accustomed to using fats like pork lard in your cooking, consider switching to extra virgin olive oil. This oil is rich in monounsaturated fats, which are recognized as good fats due to their health-promoting properties. Monounsaturated fats are not only beneficial for enhancing liver function, but also play a crucial role in reducing inflammation throughout the body. The consumption of extra virgin olive oil can be particularly advantageous for individuals dealing with liver fat, as it helps mitigate inflammation and supports overall liver health. 6. Consume fiber. Fiber is an essential component of a healthy diet, offering numerous benefits, especially for those managing liver health. Foods rich in fiber not only contribute to overall wellness but also contain omega-3 fatty acids, which have their own set of health advantages. One of the key benefits of dietary fiber is its ability to moderate the glycemic index of foods, which helps prevent spikes in blood sugar levels. This is particularly beneficial for those with liver fat, as stable blood sugar levels help manage or prevent complications associated with liver conditions. Excellent sources of such fiber include chia seeds and flax seeds. Personally, I prefer flaxseed for its versatility and nutrient profile. What type of fiber do you consume? 7. Consume nuts and seeds. Incorporating nuts and seeds, like walnuts and almonds, into your diet is a highly beneficial practice for maintaining and improving your health. These nutrient-dense foods are packed with essential vitamins, such as selenium and zinc, and are excellent sources of healthy fats. These fats play a crucial role in various bodily functions, including cell maintenance, hormone production, and support for the immune system. Here are some additional reasons why nuts and seeds are indispensable in a healthy diet. Proteins. Nuts and seeds are a robust source of protein, which is essential for building and repairing body tissues. Fibers. They contribute significantly to digestive health and help regulate blood sugar levels, making them particularly valuable for managing diabetes and enhancing metabolic health. Antioxidants. Nuts and seeds contain antioxidants that combat free radicals in the body, thus helping to prevent chronic diseases and reduce inflammation. Heart health. The mono and polyunsaturated fats found in nuts and seeds can dramatically improve heart health. They help reduce levels of bad LDL cholesterol while increasing good HDL cholesterol, promoting a healthier cardiovascular system. It's important to consume nuts and seeds in moderation due to their high caloric content. A small daily serving is sufficient to reap their health benefits without exceeding your daily caloric intake. Integrating these into a balanced and varied diet can significantly contribute to maintaining overall health. Thank you for watching today's video. We hope the information shared has provided you with valuable insights into maintaining liver health and improving your daily lifestyle. If you found this information useful, please don't forget to subscribe to our channel and share this video with your friends and family. Your subscription and shares not only help our channel grow but also support the community in accessing useful health information. Make sure to hit the notification bell so you don't miss any of our upcoming videos. Thank you for watching, and we look forward to seeing you in the next video. Hello everyone, welcome back. We are Healthy Care. In today's video, where we'll be diving into the top 10 strategies to reverse fatty liver disease and boost your liver health. As of 2024, fatty liver disease is not just a rare condition, it's a growing global concern, affecting around 25% of the population worldwide. In the United States alone, it is estimated that over 100 million people are living with some form of liver disease, with non-alcoholic fatty liver disease, NAFLD, accounting for a significant portion. This alarming rise is linked to modern lifestyle factors such as poor diet, sedentary behavior, and high rates of obesity. But there is good news. With the right lifestyle changes and natural approaches, you can actively work to reverse fatty liver disease and restore your liver's optimal function. In this video, we'll share the most effective tips and treatments that you can start implementing today. Make sure you stay tuned until the very end, because these steps can truly transform your liver health and help get you back on track. Let's get started on the journey to a healthier liver and a healthier you. 1. Weight loss. Losing weight is one of the most important things you can do to reverse fatty liver disease. Carrying excess weight forces your liver to work overtime to process fats. Shedding just 5 to 10% of your body weight has been shown to dramatically improve fatty liver. To lose weight, focus on cutting out processed foods, sugary drinks, and large portions. Instead, eat plenty of vegetables, lean proteins like chicken or fish, fruits, nuts, seeds, and whole grains. Be sure to avoid fried foods and limit red meat. Eat smaller, more frequent meals throughout the day to keep your metabolism and energy up. Cutting calories doesn't mean starving yourself. Aim for a modest calorie deficit of 500 calories per day to lose about 1 pound per week. Use apps to track your calories if needed. Losing weight gradually through dietary changes allows the liver to work less hard while burning off dangerous visceral fat. 2. Increase good fats. One common myth is that all fats are bad for fatty liver disease. In reality, certain fats benefit liver health. Monounsaturated fats in foods like olive oil, avocados, and nuts help regulate cholesterol and insulin levels while decreasing liver inflammation. Omega-3 fatty acids found in fish, walnuts, flax seeds, and vegetable oils also reduce fat stored in the liver. However, it's important to balance omega-3 intake with moderation of omega-6 fatty acids from processed vegetable oils, as excessive omega-6 consumption can contribute to inflammation. For optimal health, focus on increasing omega-3 foods while limiting processed foods high in omega-6 like soybean and corn oils. Limit saturated fats from red meat and dairy, and avoid trans fats from fried, processed foods. Instead, use extra virgin olive oil for cooking and dressing salads. Snack on a handful of unsalted walnuts or almonds. Add ground flaxseed to oatmeal or smoothies. Swap butter for mashed avocado on toast. Focus on getting 2 to 3 servings of good fats per day. Adding more monounsaturated and omega-3 fats to your diet will give your liver the good fats it needs to function at its best. 3. Drink coffee daily. Coffee might just be the ideal beverage for reversing fatty liver disease. Studies reveal coffee drinkers have significantly lower risks of developing fatty liver compared to non-coffee drinkers. Caffeine and antioxidants in coffee, like chlorogenic acid, protect the liver from damage and make it easier to burn fat as fuel. Black coffee is best since added creamers and sweeteners add calories. Drinking 2 to 3 cups per day provides benefits, but be sure not to overdo it since excess caffeine can cause anxiety and sleep issues for some. For alternatives, green tea, which also contains antioxidants, has been shown to improve liver enzymes at 4 cups per day. Herbal teas like chamomile, turmeric, and dandelion may additionally protect the liver. Brew yourself a cup of hot coffee or tea in the morning to start your day right. Just sip cautiously throughout the day. Staying hydrated with water is also crucial, so have a glass between caffeinated beverages. Protect your liver while satisfying your next coffee craving by making it part of your daily routine. 4. Manage stress. Chronic stress takes a toll on your health, especially liver function. Stress hormones like cortisol trigger fat storage and inflammation. Learning to manage stress is key to reversing fatty liver disease. Make time each day to practice deep breathing, meditation, yoga, or prayer. Setting aside 30 minutes for calm reflection reduces anxiety. Consider downloading a meditation app to access guided sessions. Journaling your thoughts is another stress reliever. Squeeze in whatever activities make you happiest, even if just 10 minutes daily. This could be reading, walking outside, listening to music, or enjoying a warm bath. Learn your stress triggers so you can better cope or avoid them. Talk to a counselor if you need extra support. Poor sleep also exacerbates stress. Be sure to get 7 to 9 hours nightly. Give yourself a regular bedtime without electronic devices. Managing daily stress prevents surges in hormones that interfere with liver function. Your liver needs you at peace to optimally cleanse and renew itself. 5. Increase probiotics. Optimizing your gut health is important for reversing fatty liver. Taking probiotic supplements and eating probiotic foods helps reduce inflammation, improve gut barrier function, and support healthy digestion. Probiotics may also help regulate fat metabolism in the liver. Good food sources include yogurt, kefir, sauerkraut, kimchi, kombucha, miso, and some aged cheeses. Look for brands with active cultures listed. Taking a daily probiotic supplement containing at least 10 billion CFUs of strains like Lactobacillus and Bifidobacterium is recommended. Probiotic foods and supplements help restore healthy gut flora, which gets thrown off by poor diet, stress, and antibiotic use. A leaky gut allows toxins and bacteria into the bloodstream, which can drive liver inflammation. Supporting healthy gut function with prebiotics and probiotics helps reverse this process. Prebiotics provide fuel for probiotics to thrive. Get prebiotics from foods like garlic, onions, leeks, asparagus, and bananas. Taking both probiotic supplements and eating prebiotic fiber helps cultivate a healthy microbiome for better liver health. 6. Increase fiber intake. Soluble fiber is invaluable for reversing fatty liver disease. Fiber helps rid the body of excess cholesterol before it can accumulate in the liver. It also slows digestion, which stabilizes blood sugar to prevent insulin resistance. Insulin resistance causes fat buildup in the liver. Aim for 25 to 40 grams of fiber daily from foods like oatmeal, beans, lentils, berries, apples, and nuts. Gradually increase fiber to avoid bloating. Drink plenty of water as well, since fiber draws in moisture. Eat oatmeal topped with fruit for breakfast. Snack on raw vegetables with hummus. Add beans or lentils to salads and soups. Swap white rice for brown rice and quinoa. Have an apple with peanut butter for a fiber-filled snack. Sprinkle chia or flax seeds onto cereals and yogurt. Taking a daily fiber supplement can also aid in reaching your goal intake. Over time, increasing soluble fiber will help cleanse your liver of excess triglycerides and cholesterol. 7. Take milk thistle. Milk thistle is an herbal supplement recognized for benefiting liver problems. Its active antioxidant compound, silymarin, protects liver cells from damage caused by fatty liver disease, cirrhosis, and other conditions. Milk thistle also helps the liver regenerate new cells. Take 250 to 500 mg of milk thistle extract daily. Look for capsules standardized to 80% silymarin. Milk thistle is considered very safe with few side effects, besides occasional upset stomach or diarrhea. Check with your doctor first, especially if taking other medications, or if you have a ragweed allergy. While more evidence is still needed, early research has found milk thistle supplementation improves liver enzymes, insulin resistance, and cholesterol in people with fatty liver disease. Seeds can also be brewed into tea. Grind seeds in a coffee grinder first to release beneficial compounds. Add lemon juice to increase absorption. Though not a cure on its own, milk thistle is a simple addition to support your liver's recovery when combined with lifestyle changes. 8. Get regular checkups. Finally, getting regular checkups ensures you remain on a positive path to reversing fatty liver disease. Make appointments with your primary care doctor every 6 months to monitor liver health. Simple blood tests like ALT, AST, and GGT enzymes indicate how much inflammation exists. Request an ultrasound periodically to check for fat around the liver. Screening for complications like cirrhosis involves additional tests. Record your numbers to see concrete improvement. Bring a list of questions to appointments, including any new symptoms. Discuss how medications and supplements influence your liver. Review any recommended dietary changes. Ask about the need for vaccines against hepatitis A and B viruses that damage the liver. Though doctor visits may seem tedious, they provide vital insight you cannot obtain alone. Be open about struggles so your doctor can modify guidance accordingly. Consistent check-ins reinforce accountability as well. They can confirm the benefits of the healthy changes you've made or indicate when more effort is needed. Tracking your fatty liver disease with the help of a healthcare professional can help you feel more empowered in the long run. 9. Stay hydrated. Drinking enough fluids is vital for optimal liver function and health. Water helps the liver efficiently metabolize stored fats and filter out toxins. People with fatty liver often do not drink enough fluids. Make it a priority to stay well hydrated by drinking at least 2 to 3 liters of water daily. Always carry a water bottle to sip from throughout your day. Choose water over sugary sodas and fruit juices that can worsen fatty liver. Add sliced lemon, lime, or cucumber to water for flavor. Limit alcohol consumption as well, including beer and wine, since alcohol stresses the liver. Drink a glass of water between each alcoholic beverage. Remember, hydrating properly aids liver and kidney function while keeping your body energized. Your liver cannot cleanse itself without adequate water intake, so keep drinking that water. 10. Exercise regularly. Along with diet, exercise is vital for reversing fatty liver disease. All forms of physical activity help reduce fat stored in and around the liver. Aim for 150 minutes of moderate exercise per week, like brisk walking, swimming, cycling, or using the elliptical. Jogging, aerobics, and playing sports a few times a week will also keep your heart rate up. For even greater benefits, add 2 to 3 strength training sessions using free weights, resistance bands, or machines. Weightlifting promotes fat loss while building calorie-burning muscle. Vary your workouts to avoid boredom. Go for a hike on weekends, or take the stairs whenever you can. Sedentary lifestyles make fatty liver worse, so break up sitting periods by getting up every 30 minutes. Start slow if needed and increase intensity over time. Even light exercise is far better than none when it comes to liver health. But strive for greater cardio and strength gains as you are able. Your liver will reap the rewards of getting your heart pumping. And there you have it, the top 10 ways to reverse fatty liver disease and restore your liver health. Even small, consistent changes can make a big difference in getting your liver back on track. Remember, the key is to be patient and committed. Over time, these steps can help reduce fat accumulation and inflammation in your liver. The liver is a remarkable organ with a natural ability to heal itself, as long as you provide it with the right support. We hope you found this video helpful. If you did, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more health tips and valuable content. We can continue creating these free resources thanks to your support. Stay healthy and take good care of yourself. Click on our channel logo to subscribe or check out another health video to keep learning.